This video is going to cover medication administration. So before I go in my patient's room, I'm going to review my orders to determine which medications I have to give. So this is what the screen will look like. For the purpose of medication administration, we're going to scroll down to the MAR, which is the medication record. Once I click on the MAR, it'll show up what's due. So right now, I have a medication called haloperidol due. I'm going to write that down so I know what to pull out of the med cart. It'll be 2.5 milligrams. I need to give it now, and it's going to be intramuscular. Here, the provider has noted how many mLs I have to give. As you move in the program, it'll be your responsibility to determine how many mLs will have to be given by doing a math problem. Next, I have heparin. I'm giving 7,500 units now, subcutaneous, and is 0.75 mLs. And then lastly, I have to give levothyroxine, 0.2 milligrams every hour, but it's due this hour. Okay, now I'm gonna go to the med cart to find my medications. So as you see here, you'll have a directory, and everything that's ordered will be on the directory. So the first thing I need to find is haloperidol, so I'm gonna search my list until I see haloperidol, and here it is. So this says I need to go to drawer 4, which would be this drawer, column 1, which is right here, this column. I know this is going to be IM, so I'm going to pull the appropriate supplies I need for IM medications. All supplies will be in the top drawer. So IM medications, we're going to use a 22 gauge needle, a blunt tip to draw the medication up, an alcohol swab, and a Band-Aid. Next, I'm going to go to heparin. So on my list, I'm going to find heparin. Here, it's drawer 3, column 2, so 1, 2, row B. So on the side here, you'll see that they are labeled A and B. Some may be C and D. I need B. So I'm also going to pull the supplies I need for a sub-Q injection from the top, which would be a 27 gauge needle, a Band-Aid, and an alcohol swab. Lastly, I need levothyroxine. So again, I'm going to come to my list and find levothyroxine. Maybe on the other side. Right here, it's 100 micrograms. I know I need to give 200, so I'll have to pull 2. So I need to go to drawer 2, column 1, row C. I'm going to pull 2 of those out. The only supplies I would need for this would be a medicine cup and some fluids for the patient to drink. So now that I have all my medications, I'm going to gather all my supplies and go to the bedside. Now that I've gathered my supplies, I'm going to enter my patient's room. I have all my medications prepared. I will do everything that's necessary before when I enter my patient's room as far as aid it, anything else that need to be done. But I'm going to get right into medication administration. So there's several checks you want to do with your medication. The first check would have been at the Pyxis, which we already verified when I wrote the order down. Then I'm going to do a check when I scan. I'm also going to verify my patient is some of the rights. So there's several rights we're going to talk about. First, I'm going to talk about the right patient. So I'm working with Noelle Smith here in the computer. I'm going to ask my patient, can you tell me your name and date of birth to make sure it matches her wristband and make sure it matches in the computer. After I verify all of that, I've identified the right patient, Noelle Smith, 1/9/1997. She said that, and then it's the same on her wristband here. So the right patient is done. I'm giving 3 medications. I don't have to do the right patient every single medication. So that will be done for the rest of this checkoff. Then I'm going to scan the patient because now we're going to go into right medication, right dose, right route, right time. So So once I scan her wristband, the computer is going to recognize that I'm working with her, and it's going to pull up the medications due for her. So the first one we're going to get into is oral, which is our levothyroxine. So I'm going to do another check here, and the computer will help me check. This is my second check. So this is what was ordered, and I need to verify what I'm scanning matches that. If it didn't match, it would alert me that there was something wrong. So levothyroxine, the dose is 0.2, so I'm going to scan 2 of them. 0.2 milligrams will pop up here. It's the time is now, or the frequency is now, and the right is oral, which I do have capsules here. So I'm going to open up the packages here and put them in my medicine cup. If I were to drop these, or anything were to contaminate them, or they were to, open in any capacity, I would get new capsules. So I'm going to have my patient swallow these with the appropriate fluids, water, and once she swallows them, I would take the cup and throw it away. Obviously, she's a mannequin and she's not going to swallow those pills. Okay, we're going to move on to the next medication. So we're going to do haloperidol. I'm going to scan it again to verify the right medication. So it opened up here, 5 milligrams. Here I have 5 milligrams per 1 ml. It's to be given now, right time. The route is intramuscular. While I prepare, first I'm going to prepare the medication. It is IM, so I will have to don gloves once I start. So this is not clean. This is not sterile. So you do have to clean it. You want to wipe for 30 seconds and let it dry. For education purposes, the 30 seconds is up. While that dries, I'm going to put on my gloves. This is intramuscular, so there's several sites you'll learn about. The dorsalis, gluteal muscle, the deltoid muscle, and the vastus lateralis. I'm going to opt to give it in the deltoid muscle. So now that that's dry, I'm going to prepare my medication. So I do have to get a blunt fill needle. So before I actually want to prepare the medication, I am going to put the dose here because it didn't scan. So my dose is 5. We verified that with the wrapper of the medication. So we're going to put 5 milligrams here. And then location, like I said, I'm going to give it in the deltoid, the right deltoid. So I'm going to scroll down to find the right deltoid. So this is dry now. You always want it when it comes to IM injections, because you're going to be entering a large muscle with a needle, that you want the needle to remain very sharp. So you never want to insert the needle through here because that's going to dull it, and then inserting it into the skin will make it even more dull and cause the patient more pain, and it could make it difficult for you to administer. So for IM, you're going to use a blunt fill needle. This is not sharp. And it never will touch the patient. So once you're done, you are allowed to recap it. You should never uncap and recap any needle that's sharp and is going to enter the patient. So you're going to insert here, invert the vial. We're drawing up 0.5, we're drawing up 1 ml. And we're giving 5 milligrams. So we're at 1 ml. This medication is all done. I'm going to put it to the side so it doesn't get confused. Put the blunt disc back on here so you can twist it off. And then I'm going to attach the needle we will be using to insert or to administer the medication. You are going to want to wash the site with alcohol and have a Band-Aid ready to apply once you're done. So now I'm going to come to my patient. With your patient, you always want to discuss why the medication is being given, how you know it's working, and do any assessments that are required to give the medication. You'll learn more about that in pharmacology. So I found the right deltoid. I'm going to clean using the basket weave approach for 30 seconds again and let it dry. So we can say that's been 30 seconds for education purposes. and it's dry. So I'm gonna uncap my needle. I wanna keep my left hand out of the way. Don't touch the site because you want it to remain clean. For IM injections, you're gonna inject at a 90-degree angle, and you're gonna wanna do it quick and firm to decrease the amount of pain. So I'm gonna warn my patient, 1, 2, 3, inject, push back on the plunger, and I'm all done. This needle does not have a safety, so I'm gonna remove it and immediately put it in the sharps container. And now that my sharp has been thrown away, I'm gonna place the Band-Aid. You don't wanna massage the site or do anything like that. So we're done with the haloperidol. We gave the 5 milligrams. We're gonna move to the next, which is going to be our heparin. So we scan the heparin, the dose is 5,000 units, so you want to type in 5,000 here. And as you see, this says units, it populated as milligrams. So you want to change this because you're giving units. This is a part of your documentation. Whenever you administer medication, you do have to have the correct documentation. The location, I'm going to give it in the right upper abdomen. So because it's subcutaneous, we inject into fat. You can inject behind the arms, the posterior aspect of the arms, and the lateral aspects of the thighs. Sorry. You want to do it in the fattiest areas. So again, I have to prepare my medication. When it comes to subcutaneous medications, because the needle is so fine, you do not have to use a separate blunt fill needle. You can use the same needle to draw the medication up and administer. Again, we do that for 30 seconds and let it dry. I'm gonna open my needle. So the medication is 5,000 units. The medication comes in 10,000 units per ml. I'm only giving 5,000 units, so I'm gonna give half an ml. As you go through math, when it comes to your final checkoff, you will be responsible for knowing how to compute the dosage calculation. This is a safety. You want to keep this out of the way until you're done administering. You are going to uncap the needle, but you're never going to recap it because this is a sharper needle. As soon as you draw the medication up, you want to be ready to administer the medication to your patient, so you want to have your alcohol swab ready. We're giving half an ml. So as you see here, we're going to pull it down to half. You're injecting air because it will create a vacuum in the smaller syringes, and it'll naturally fall back. So as you can see, it'll pull itself back, and it'll make it easier for you to pull down. You see I'm getting a whole bunch of bubbles. So with that being said, you're gonna wanna flick the syringe to get the bubbles out, because you never insert bubbles into your patient. That's considered air. And then push back up until you get to the 0.5. My syringe is free of bubbles. Now we're gonna go over to our patient. We're gonna pull back the gown, notify the patient what you're doing. Again, you would provide education, do your assessments. You're gonna clean the area, the right upper abdomen, in a basket weave. Let it dry. For subcutaneous injections on patients who are thin or normal weight, you go in at a 45-degree angle, which is this. A 45-degree angle is here, and you can inject that way. For patients that are obese, you can go in at a 90-degree angle, similar to IM, which is like this. So when you say 90-degree, the syringe and the patient would make a 90-degree here. So this is a safety. When you pull back, you're gonna push this down, and it's gonna protect you from getting poked. And you're gonna discard your sharp and put a Band-Aid on. So now I've gone through all my medications. They've all been given. So I need to make sure they're all documented. So I have my heparin. I gave 5,000 units in the right upper abdomen. I have my haloperidol. I gave 5 milligrams. In the right deltoid. And then I have my levothyroxine. I gave 0.2 units orally, so I don't have a location. I'm going to go through here one more time. Went through one more time, and I noticed that the milligrams was empty. Again, you want to make sure this is all accurate for your documentation. Everything looks good. I'm going to hit update chart. And as you go through, you will see that it's marked given with your initials. There's one more thing we're going to show you just so you can see it, and that's giving an oral solution. I'm not going to wear gloves for that because I'm not actually giving it to a patient. But sometimes medications, especially in peds, are given orally, and they'll be ordered based on volume. So as you can see here is the side, there's milliliters. So let's say the doctor ordered 20 milliliters. You want to keep it flat on a surface when you're filling it. And you want to, pour flat on the surface. And you want the fluid to measure the bottom of it at the 20. So we call it the meniscus, which is the line of the fluid. Here, you want the bottom of the meniscus or the fluid to align to the lines at 20.